How is the anterior cingulate cortex related to relapse? Have you ever wondered how certain parts of our brain influence our choices, especially when it comes to addiction? Today, we will focus on the anterior cingulate cortex and its connection to relapse in substance abuse. The anterior cingulate cortex, often referred to as the ACC, plays a vital role in decision-making, emotions, and impulse control. When someone is dealing with substance use disorder, the ACC becomes particularly important in understanding the risk of relapse. Relapse occurs when someone returns to drug use after a period of not using. When a person with a substance use disorder encounters drug-related cues, like seeing drug paraphernalia or being in familiar places, the ACC becomes highly active. This activation is directly linked to increased cravings for the substance. Research indicates that individuals who show greater ACC activity in response to these cues are more likely to relapse. This suggests that the ACC acts as a central hub, connecting cravings to the loss of control over drug use. The ACC is also involved in cognitive functions such as inhibition and emotion regulation. When someone has problems in these areas, which is common in addiction, it becomes harder to resist urges and avoid relapse. If the ACC is not functioning properly, a person may find it difficult to stop themselves from seeking drugs, even when they genuinely want to quit. Different regions within the ACC have specific roles. Some areas are more focused on craving, while others deal with emotional responses or decision-making. This means that the AAC's contribution to relapse can vary based on which part is affected. Understanding these differences could help tailor treatments to meet individual needs. Neuromodulation, which involves techniques to alter brain activity, is being researched as a way to target the ACC in individuals with substance use disorders. The idea is that modifying ACC activity might reduce cravings and improve control over behavior, potentially lowering the risk of relapse. However, more research is needed to determine which methods are most effective and for whom. Recognizing the role of the ACC in relapse can help explain why some traditional treatments may not work for everyone. New approaches that focus on the brain's control systems might offer hope. For those involved in substance abuse treatment, this knowledge supports the development of therapies that address not only the physical aspects of addiction but also the brain processes that lead to repeated drug use. In essence, the anterior cingulate cortex is a key player in the cycle of addiction and relapse. Its activity in response to drug cues is closely tied to cravings and loss of control, making it an important focus for understanding and treating substance use disorders.